record.
Okay, we're recording this. So we're going to share the screen. Okay, here we go. So assessment number 2. It's a short answer question. As we know, it's viewed through Turnitin. It's worth 35%. It's due at 5 p.m. on the 6th of the 5th. Okay, 5 p.m. There's 3 different questions, and we'll go through each section. So if you need an extension for this assessment, you need to email the unit email address and you have evidence. If you need more than 5 days for extension, you need to apply for special consideration. And that, of course, is through eForms. I'm Debbie, this is Nicole. Okay, so our case study, we've got Mr. Kirkman. He's a 75-year-old presenting to ED with burning sensation upon urination, lower abdo pain, radiating into the right flank. He was admitted to the ward with a urinary tract infection. He was placed on IV antibiotics and some IV normal saline. 24 hours later, he deteriorated. His heart rate's now 135, so he's tachycardic. His blood pressure's 80, his respirate's 35, his temperature's 39, and he looks unwell. This is his history. So his diagnosis 24 hours later is UTI with severe sepsis. This is the focus of our assessment, severe sepsis coming from the urinary tract. There's your primary survey, which is what we're going to need to discuss in section 1. Okay, so he's got speaking in single words, his respirate's 35, he's using his accessory muscles, his SATs are only 82, he's in obvious distress, his blood pressure's 80, he's in sinus rhythm but tachycardic, his temperature's 39, he's got a GCS of 13, he's got lower abdominal pain 6 out of 10 and a flushed face. He's also got dark urine, and you'll see later on in the case study he's also got a UA. You can link that UA into your dark urine. And he's got decreased urine output and glucose is 8.4. This is his ABG, full blood count, coagulation, and ureas and creatinines. For your last section, you're only using this part, but you can use these to support your evidence in the first section. Okay, in regards to question 1, these are the questions that have been sent to us already. Do I write the pathogenesis of symptoms like burning sensation upon urination? Answer to that simply is yes. It should be based on how did he get the symptoms in the first place and what is the body's mechanism to compensate for them. Because sometimes the compensation is what's the symptom rather than the symptoms coming from the compensation. So when I'm saying that, I'm talking about things like your renin-angiotensin system. Decreased urine output. Why is it decreased? It could be because his blood pressure is so low, so that's kicked in. So you've got to also talk about your compensation mechanisms as well as how did it occur. So something like how did it occur would be your inflammatory system. Any questions? Where's my hand? Raise my hand.
5.
Okay, let's have a look. Wait a second, stop share.
Here we go, questions and answers.
Okay, any other questions?
No questions at the moment.
No questions at the moment, okay. Next one. Please, could you consider elaborating on high priority nursing? Well, I'm not going to give you the answer to that. Have a look at your primary survey, start from the top, at being the airway, and then look down and see what you think is your high priority nursing. You know, there's lots of them in there. There's lots.
And you guys have been given the septic pathway. It's something that you can go in and review as well.
Okay, what would it mean to critically analyse the arterial blood gas diagnostic result? You need to discuss all of the factors in detail. So we want to talk about the pH, why is it low? Talk about the lactate, talk about the HCO3. You need to speak about all the diagnostic factors in there and relate it to the pathogenesis. In this section, you might have a few bits that match with your first section. That's what we're expecting. because you're talking about inflammatory markers, you're talking about inflammation. This is what's going to be in your ABG.
I think last year people were good at analysing the ABG, but what they weren't good at is relating to the underlying pathogenesis of the patient's condition. So like what Deb's saying, it's a repeat of what you've already said in that first section.
You can't just say the lactate's high and that means that they're acidotic.
Yeah.
It's just not going to, that's not enough. You need a little bit more information as to why is the lactate high. Any questions?
So there's really not, they're not asking. So you guys, this is a question time for you guys. So you can go in and type in your question and it will come up on our screen and then we'll be able to answer you.
These ones.
Have a look at that, see what chat for.
Okay.
Here we go.
I'm still doing PPE3. I find it difficult.
Will it be available on Views?
Yes, it'll be available on Views. We'll be saving it, and I'll also put this PowerPoint on Views as well. Any more questions? If you've done HV3, you should be able to analyse this. Okay.
Maybe you just got to click into it and just go done. It disappeared.
Okay, excellent.
Yeah.
You can see it right here. Okay. For question 1, do we need to say which bacteria resulted in the UTI? Not necessarily, but there is common bacteria that cause the UTI, so it would be, worthwhile adding it in, yes. Do we need to include normal ranges when discussing this case? No, definitely not. Don't rewrite anything we already know.
Could you please describe the little bit on the first question? What does that mean?
I'm not sure what that means. Could you please describe the little bit on the first question? The word limit is just 1250, so talking about all these gases, yes, it will. We've already had, we've written them ourselves to make sure that it fits, definitely. Definitely fits. Short and sweet, to the point. Don't talk about things that we can already see in the case study. We don't need to know that Mr. Kirkman's history. We already know that. Start straight from the fact he's got a UTI and how did he get it.
And you guys had a really good paper in week 1. I don't know if you guys can see this, about sepsis and septic shock. This is a worthwhile journal article to go back. It's in week 1. Deb's put it under supplementary material and that. So that article I would read today and have a good look at it and see how you can relate that to this case study.
Okay, Marianne, do we need to include normal ranges when discussing? No, definitely not. You just need to say that it's high, so is febrile, and discuss why.
Yeah.
Can you please go over question 1 again? I'll go again. So do we need to explain from urosepsis or need to mention, you're talking about the same thing there. I'm not sure what you're asking.
You can start from SIRS. So you can start from SIRS and then, that little arrow that starts from SIRS and goes all the way up to septic shock. Have a look on that arrow and see where your patient sits there. This patient is in septic shock. So have a look at the, how it started and then how it's gone all the way up to septic shock.
How did it progress?
Yeah.
That one's done, that one's done. Do we need references for 3 questions? Yes, you do. We're expecting around about 5 references in total. 5 at least is what you'll need. Please go over question 1 again a bit slower. Okay, question 1. So let's go back to him. Here we have him. Yeah, so his rest rate's 35. Why is it 35? What compensation is that a result of? Why is he using his accessory muscles? Why are he sat so low? Why is his blood pressure dropping as a result of SIRS? And as a result of the blood pressure dropping, what other system is it initiating to try and conserve the fluid? So there, if you understand what I'm saying, I'm trying to say you would talk now about the fact that he's using the renin-angiotensin system. So he's conserving the urine. Therefore, Mr. Kirkman has a decreased urine output. Why is he tachycardic? Well, his SATs are low, his rest rate's high, so why is he tachycardic? What's happening to him to increase his temperature? Why is his GCS only 13? So think about that.
You need to answer each of the, so the question is the pathogenesis of the urosepsis, and you need to relate that to, to each clinical manifestation that you've been given.
So think about your tutorials for the first 3 weeks. We went through your renin-angiotensin system. We went through your inflammatory system. We went through your VQ mismatch.
Yep.
We went through your every single one we did in the first 3 weeks, you will use in this assessment. That's why we did them again. Even though you've done them in HV3, we went through them again in the first 3 weeks.
Yeah. So it's all your neurohormonal responses to, to a shock state.
Any questions? Done. Do you need to get done? Yes, done. What book can we use? Whatever books are available in the library or online.
Yep. And that one that we've just talked about septic shock, from week 1, that was in the supplementary material.
Yep. Do we need to discuss the RAS system by step, or is this assumed knowledge so that we can mention the RAS? No, it's not. We don't assume that you know anything. You need to talk about it and tell us what's going on. For the UA, it says that it's positive for nitrate, leukocytes and blood. To what extent is those things evident, like the colour of the strips?
So they're talking about, so if you're talking about the urinalysis.
So why are there leukocytes in his urine? Yeah. Why is there nitrates in his urine? Why is there blood in his urine? Got nothing to do with strips.
No, you don't need to start talking about the colour on the strips.
No. You don't. You just got to say that his urinalysis says this.
Chantel's happy. Chantel said, thank you very much. Thank you, Chantel.
Thank you, Chantel.
We appreciate that.
We're trying.
Yeah.
Okay, so some other questions that we've had. Do we start at the cytokine level? Yes, you should. Like we said, start from the bottom and work your way up. Don't be wishy-washy, get straight to the point. That's what we're expecting. Short answers is short answers as it is. It needs to be written academically, but it doesn't need to be in like, Mr. Kirkman has this and this and this. You could say in the primary survey, in breathing, Mr. Kirkman has this. Mr. Kirkman's respirate is this because of. Next. In his circulation, Mr. Kirkman has a blood pressure of this. Mr. Kirkman's blood pressure is this because of this has caused his urine to decrease because of this.
Yeah. It all ties in together. It's all like a big puzzle that all sort of ties in together.
If you know where should you use references, I think that's self-explanatory. You guys are 3rd years now. You're not going to make this stuff up, are you? You're going to have seen it somewhere.
Throughout. References throughout.
Okay, next question. In regards to 3, do I mention only arterial blood gas or the entire blood result? Just your ABG. Yeah. The full blood count and everything else you may want to use to discuss in your pathogenesis in the beginning. Yeah? So you might want to say, as your inflammatory responses kicked in, what in your full blood count is going to be raised.
Okay. You've got an important one in your full blood count that you definitely need to be talking about, especially when you're talking about SIRS criteria and septic shock.
Yeah, there's one that's raised there that you definitely need to talk about. So have a good look at that full blood count.
Yeah.
Nursing strategy, it's got to be nursing. You can't say that you're going to give antibiotics unless it's been charted. So I would stick to something more nursing related. So oxygen therapy, yes, you can use, but you'll need a rationale for that. Or things like
we should be starting at airway. Like whenever you walk into a patient's room and you look at them, you're starting at airway, breathing, circulation, disability, exposure, fluids. You're moving your way down the person's system. But it needs to be something high priority. In the past, we've had stuff like use relaxation techniques. That's not a high priority like for your patient.
You'll lose marks for
this patient is critically ill, so you need to be thinking what this patient needs immediately now.
Yeah, so you might want to discuss his urinary sepsis. He's got a decreased urine output. Think about that. Okay, next, when describing the pathogenesis of UTI, can we state that it's yes, you can, definitely. How many references? At least 5. At least 5. These are the books that we've got online that you should be using. Pharmacology you won't need to use because you haven't got a drug this year. But these other two, you should be definitely using those.
Yes. And you've got your Australian Critical Care Nursing text, and you've got
your trauma and emergency. They're also available online.
And have a look at journals for septic shock as well. So they will assist you with your response as well.
You should try and have your references less than 5 years old to keep them new, but, give or take a year. Yeah. Any more questions?
Have a look at the slide. No. We'll give you just a minute to see if you can
have a think. So make sure you're relating this back to Mr. Kirkman. Mr. Kirkman, our 75-year-old male, we need to relate it back to him. Remember, he's got no cardiac history, so this rhythm, sinus tachycardia's got nothing to do with his cardiac history because he has none. No previous UTIs. He is a heavy smoker, but that's not got to do with this. Could you please, where should we use references? All throughout. Need to can you put the
That's in week 1. The ABG analysis is on the View site. It's still embedded in week 1. So if you want to go back to the ABG video, or you want to go and have there's 2 different ways of interpreting arterial blood gases. So one was the tic-tac-toe, and then another one is like a different method to analyse. That's still there. So go back into week 1 to get that.
Alternatively, just get on YouTube and look up arterial blood gas analysis. They're everywhere.
Yeah, at the end of the day, you're going to analyse that ABG. It's going to take you a couple of minutes to do it. So you're going to slot in your answer for that. But it's then relating back to the underlying pathogenesis that you're going to get more marks for once you tie it all back in together.
Should we mention his bronchitis in here or just no, definitely not. We're not talking about anything to do with his history. As we mentioned before, this is now the acute diagnosis of the UTI with severe sepsis. That's got nothing to do with bronchitis. Anything else?
Thank you.
No problem. So is this hard? Don't make this hard. Go back to your first 3 weeks. Go back to your HV3 stuff. Go back to those main pathophysiological statuses that you'll need to study for your exam anyway, and that's what we're looking for. Every single one of them is used in this case study.
Yes.
Correct.
Correct. So for question 1, it is basically how the UTI leads to severe sepsis. Yes.
And what's happened? What's happening in the body? What's the body doing because of it?
Yeah. How did it cause each of those clinical manifestations?
Yes, you should.
And what compensatory mechanisms were then activated?
So,
yes,
Raven Jeanne, when would you mention the white cell count being high? When you're talking about your inflammatory response.
Yeah.
So yes.
Yeah, that's important.
Correct. How it leads to...
Yes.
Yep, definitely. Yes. Yep. So not just what's happening now, what else is happening?
What is your body doing in response?
What's your body doing in response?
You guys are getting it.
That's it. Perfect. Yes, you should mention your white cell count. It's definitely, because it's a big part of your inflammatory response.
Yeah.
We hope these to be marked within 3 weeks to get them back to you. Anything that's a fail or a HD will be looked at and cross-marked. You mightn't see whether or not it's been cross-marked or had a look at it a second time, but it definitely has. It definitely will be. Nicole and I are doing that. That's our job. So, yeah. I think we've covered most of your questions. Anything else? As I said, I'll put the
I guess the tutors as well.
Yeah, you can speak to your tutors. Your tutors have been instructed. They're not allowed to. We'll shut this so they can see us. Hey, in slideshow. Okay. So your tutors, Nicole, this is Debbie, your tutors have been instructed that they can't proofread your assignments because that would be inequitable because not all tutors are going to have time for that. But they can have a look and see whether or not you're on the right track, and let you know if you're missing anything in particular that's of major importance.
Yeah.
Should you be talking about the oxyhemoglobin curve? If you want a HD, yes, definitely. Can we get a sample paper? No, you can't. We can give it to you at the end, but no, we're not going to give it to you first because these sorts of symptoms are consistent throughout whatever sepsis it is.
Yeah.
So we would be giving you the answer. So, nah, that's cheating. So from the primary example, are all the, yes.
They might be able to read these questions, so you might have to read them out.
Can we get a sample paper? No. Are you expecting oxyhemoglobin? Yes. Thank you so much. You're welcome. Anything else? Have a think. We'll give you a couple more minutes.
I don't know if they can read those questions or whether. Oh, sorry.
Do we need to discuss the 4 blood counts in the first patho? Yes.
Yep. You're having a look at all your abnormalities. So go through your blood results with a highlighter and highlight everything that you can see that's abnormal. And that's something that you can incorporate into your paper.
Yeah. Yes, we can read it. Thank you for that.
I'm still unsure about question 3. Analyse your ABG. Tell us what the result is. Like, talk about every part of, like, the arterial blood gas, like lactate included, oxygen, partial pressure of oxygen saturation included as well, and then relate to the underlying pathogenesis of urinary tract infection that's led all the way to septic shock.
I don't know how to get the copy of the questions that are asked. Do you? I'll try.
Don't know, yeah.
I'll try. I'll see. I'll get onto IT and see whether or not
at the end of the day, this is recorded anyhow. So
yeah.
it's
So
recorded.
we've answered the questions. We've made sure that we're talking about what the questions you've said. So we can only do so much really.
That's it.
Yes, we've already answered about chyelonephritis. We'll try with these questions. Yes, we can read it.
I'm glad I can read it. I'm
Yeah,
sure
me too.
about that.
So if I've got these, here you go. Can I print this?
That's just their questions, though.
Yeah. Oh, yeah.
It's not really what we answered. You got the recording of what we answered. I think they can just go back to the recording.
Yeah. If you're on Facebook and you're reading stuff on Facebook that is contradictory to what we've said, or you're getting yourself worked up into a flurry, because I know that there's a Facebook site or whatever from previous years, just email us. Don't let it get out of hand. Don't let your head get mixed up. Just email us and we'll clarify it and we'll tell you to put it back onto Facebook. So if that's the way that you want to talk to each other, that's fine, but just make sure that you're giving each other the correct information, because in previous years people have given the wrong information and as a result a whole group of people have failed. So if there's a lot of things that you're talking about that everyone's asking the same questions, you need to just email us, okay? Can you please give us more information? No, I think we've covered it.
Yeah, we've covered it.
Yeah. No more. We've covered that for question 1. Mr. Kirkman symptoms, do we also need to close the passage? You've got to start from the beginning. So, yeah, start from the beginning. No, don't talk about risk factors. You're going to be wasting your time and you're not going to get marks for risk factors. No. Do we need to discuss? Yes. Is that part of your ABG? If it's part of your ABG, you need to discuss it. Do we also need to? Yeah.
You guys just really need to start reading, and that journal that I said to you, Sepsis and Septic Shock, that's in week 1, is a really worthwhile 15 minutes of your time to sit there and read it. So sit there and read that this afternoon and see how can I relate this to this case study. It will become clearer and clearer. So you guys are at the point now you need to immerse yourself with it and start trying to answer each of those clinical manifestations. Thank you, Debbie and Nicole. Excited. That's what we want to hear.
This urinary tract infection sepsis is the basis of a lot of your patients that you're going to see in the hospital next year. They're going to need to know, why is my blood pressure low? You need to know why their blood pressure is low and what's going to happen to their body in response to a low blood pressure. This is what this is doing. This is trying to get you ready for when you're out there next year.
Yeah. Anisha, for severe sepsis, do we need to talk about SIRS and sepsis? Yes.
Definitely. They're very important.
Yep.
Briefly. Everything it's nice and sweet. 1,250 words. Don't complain that it's not enough words to write this in, because then if I had said 2,000 words, you would have said that was too many words and it's too hard to do. We had to work out how to do it. You know, we think about these rationally. So, you know, there's 1,250 words. You've got 3 big sections. Your biggest section worth 15 marks is that first section. I would expect that most words in that first section.
And at the end of the day,
you've got 5 marks for your nursing intervention. That should be very brief. Brief and to the point. You're going to do this because of this, and this is going to help with this.
And at the end of the day, we want you to recognise, is this patient septic? You know, and that's what, you know, we need to be questioning ourselves. Is this a septic patient? Have they got these SIRS criteria? What's their clinical manifestations? How many minutes have I got to, you know, before I need to do something for that, for our patients? Patients die every year from septic shock, and sometimes it's because we're not recognising it.
Yep, you're allowed 10% plus or minus.
Yep.
If you want to write 2,000 words, we can change it for next year for your next colleagues, but our thought was 1,250. You're in the middle of clinical. Let's get this short and sweet so that you students don't have to overthink it. 1,250 words, straight to the point. Don't fluff around. Don't tell us stuff we already know. Just tell us what you do know. Tell us what you've learnt.
Yeah.
Tell us what you've learnt.
This is an assessment where you can learn a lot from, and then when you go into the clinical environment, you guys are going to start to question yourself, is this a septic patient? Has these people got the SIRS criteria? You know, you can save people's lives out there, and that's, you know, third-year students, you guys are nearly out in the hospital, and this is why this is such an important assessment for you guys to start sort of understanding.
Any more questions? Just remember, don't get yourself worked up on Facebook. Any questions, please just email us. Nicole and I have been answering within 24 hours everything that's coming through on our unit email address, only on the unit email address, and then we'll...
Up to
Question 3 is not worth 15 marks. Just saying.
What's it saying?
800, 200, 800. Question 3 is worth less. It's only 10.
Oh, okay. Oh, they're just trying to like allocate their word count. It's up to you guys. You know, like you look at how many marks are allocated per section, and it's up to you guys.
Mm-hmm. I think we've answered most of the questions. As I said, just email us on that unit email address 401-211.
Yeah, 401-211 at Western Sydney,
and we'll answer the questions if they haven't been asked during this. You can, but is that most priority? Here, talking about antibiotics, you can, but is that the highest priority? All good? Good luck, everyone. I hope you're enjoying clinical. And, yeah, as I said, it'll take about 3 weeks to mark them, so you'll definitely have them way before the end. Remember, week 9 is a revision week. Oh, module 9, the last week's a revision week. There'll be lots of multiple choice questions for you in class. However, they're not to be rote learnt. We'll talk about that in class, but yeah. Are you a doctor, Anisha? Do you order antibiotics?
So for question 2, can it be pharmacological or non-pharmacological? You're a nurse, yeah, so you've got to think about what if the doctor's ordered an antibiotic, then, you know, you could have a look at your septic pathway and see how you can relate that information.
I would stick to nursing.
Yeah.
All right, everybody, thank you very much, and
good luck.
Good luck.
We look forward to reading them.
Yeah, you can, here, so please clarify how this needs to be presented. You can put question 1, question 2, question 3 if you like. Yep, that's fine. They are short answer questions.
Just don't copy and paste the whole question into your, because then, like, when you look at Turnitin, your Turnitin mark's going to go higher and higher. And that's another thing that Deb and I are going to have to deal with Turnitin with, like, plagiarism.
Plagiarisms. So, if you've been caught plagiarising, 20%, anything over 20% will be looked at. So anything over 20%, panic. When will this, as soon as I've been able to save it, it takes a couple of hours to save and then upload. Yep. So we'll do it now, but yeah, before the end of the day, hopefully. Okay. Thank you, everyone.
So just go end meeting for all.